Hi, my name is Esteban Ramirez, and my presentation is going to be on how prolactin affects us. I also just wanted to state that this topic is becoming increasingly prevalent amongst things like hustle culture, 24-hour grind, things like that bring a lot of stress, and we're going to see why that's relevant right now. So, first off, to understand this, we need to understand the two conflicting hormones that are at play here. So, actually, what is testosterone? Testosterone is a hormone, and not only a hormone, it's an androgen. Androgen meaning that it brings about secondary sex characteristics such as deepening of the voice, facial hair, muscle development, all that good stuff. So, it's produced in the male gonads. The testes, the female gonads, would be the ovaries, and it helps with libido, sex drive, and in some cases thrill-seeking behavior. Also, well, testosterone usually comes about right at puberty, which is when it's at the most high, and you can sustain testosterone at a high level with proper nutrition, and proper exercise, but testosterone usually starts to decline when a male reaches andropause, which is starts to falter, and if you do any blood tests on that, after andropause, they go down significantly. I also wanted to state that there's not only testosterone, there's things like dihydrotestosterone, which is just a more potent form of testosterone that's usually associated with those secondary sex characteristics that we were just talking about. And there's also dihydroepinephrine testosterone, or dihydropinestrone for short, and androsterone, which are two precursors to testosterone. In this case, they are interacting with the adrenal glands in order to become usable for testosterone purposes. So this will play into what we see in other slides. So on to the next one. Again, to understand the concept, we need to understand the components. So we have testosterone. And what is prolactin? Prolactin is another hormone most prevalent in females than it is males. Reason for this is because prolactin actually plays a big role on the mammary gland and how it develops, which mammary gland stands for the breast, and it also prolactin, which it stimulates lactation, usually in pregnant women, but it can also happen at any age for any person, any gender. So I know you're probably thinking, how could that be a bad thing? What's our dilemma here? And our dilemma lies in when males have too much prolactin. When males have too much prolactin, the male tends to develop gynecomastia. Gynecomastia just means the breast development in males, which is not too abnormal, but it can cause some males to be somewhat self-conscious. And gynecomastia also just comes along, usually through hormone imbalance, as we're seeing right here. Apart from gynecomastia, too much prolactin can also inhibit thrill seeking and can inhibit libido, sex drive, and especially sex drive. Biologically, prolactin is there to stop males and females from over sexual pursuance, because in studies, it was shown in rats that if you remove the part of the pituitary that releases prolactin, the male rats usually exhaust themselves trying to procreate. So we don't want that happen. So what can prolactin do in males? In males, usually too high of prolactin, as stated before, it can cause gynecomastia. It can cause low sperm count, low libido, low sex drive. Um, Prolactin also inhibits the hypothalamic pituitary gonadal axis, which comes into play when the prolactin is released, and then when the prolactin goes into the blood, it reaches the hypothalamus, and the hypothalamus releases something called gonadotropin stimulating hormone. And when that's inhibited, it stops the hypothalamus from stimulating the gonads and, in turn, inhibiting testosterone, which is what we're going to see in a couple of slides here. Um, so, how does prolactin get too high, and what are the effects? Okay, so prolactin usually starts to rise after psychological or physiological stress, right? Like we're running a hard day's work, and even acute stress, like maybe a jump scare, something like that. It usually arises after that. And usually when your body is exposed to stress or after it's exposed to stress, it's gonna want to recover, right? Like after a run and you feel like, oh, I could just go for, maybe a chicken sandwich, something like that. Your body is going to want to recover, right? And that's where prolactin, insulin, and cortisol come into play. All of those signal for the body to go into recovery mode, which can lead to excess body fat. It could lead to lethargic feelings, um, all of that. This is not to say any of those things are objectively bad. It's only bad when it's in excess, right? So when you have too much prolactin, cortisol, insulin, your body will neglect such functions as stimulating testosterone, muscle hypertrophy, uh, and also inhibit the release of human-like growth factor, uh, insulin-like growth factor, all that good stuff, which is usually associated with hypertrophy, reproduction, and typically what every male is shooting for, to feel good about themselves, to feel regenerated, to have high testosterone. So, um, over here is what I talked about earlier, right? The when the pituitary releases prolactin, it inhibits the hypothalamic pituitary gonadal axis, right? And in turn, uh, inhibits testosterone, right? And that could lead to infertility, lowered sperm count, and fatigue, and no one wants that, right? So, on the next slide, we have a little diagram showing us just how it is, right? I'll explain this briefly. So, pituitary and hypothalamus, right? When the pituitary releases prolactin, it's produced and secreted, right? And this arrow shows us all where it's going to. Goes to two main locations, right? To the mammary glands where it stimulates lactation, which is its main function, right? And in some cases, it can lead to gynecomastia, as stated. And on this other arrow, we see it goes down to the male gonads, the testes, right? And when prolactin is released, it inhibits the gonads from releasing testosterone. All of this we've gone through, but we're just reviewing on a better model so we can all understand, right? And right here, where the adrenal glands are, right? It also tells us how prolactin interacts with insulin and cortisol, to store up fat, and that's something we don't want. But something that I forgot to mention actually. Prolactin is inhibited by dopamine. So dopamine is a good way to inhibit prolactin, which is about to come in handy on this next slide that we're going to present. But yeah, prolactin is usually associated with low levels of dopamine as well. So as we see on this next slide, how to decrease prolactin, right? So in this paragraph, in the beginning, we can see what we already stated, that its evolutionary purpose was to inhibit sexual pursuance, overly sexual pursuance, and satisfaction, right? But what I actually haven't mentioned is around here, that light, environment, and circadian rhythm can also take a toll on your hormones, right? I think a bunch of us know this, but melatonin has been shown to increase prolactin, and this actually comes into play with the other theory that was shown on prolactin's evolutionary purpose. Um, as melatonin increases, so does prolactin. And what has been shown is that the optimal time biologically for humans to have intercourse is at night when melatonin is the highest, and so is prolactin, because it gives us that sleepy feeling that uh can aid in sleep. But back to my main topic, nutrition can also take a toll on your hormones, right? Such as right here, low blood calcium, low vitamin D can increase prolactin, which we don't want, right? Of course. Other hormones can also take a toll. Prolactin, just like estrogen. Estrogen also increases in females during puberty, which is why you see those secondary sex characteristics such as the development of breast, excess body fat on the hips and thighs, right? And as estrogen increases, as we've said, so does prolactin, which aids in that development of the breast. Apart from that, outside the realm of biology and the organics, which we've seen here, there are also drugs, more specifically antidepressants, which can lead to higher prolactin levels. Some of these drugs, the most popular ones, are actually SSUIs, selective serotonin uptake inhibitors, which when serotonin is of excess in the blood, it can also increase vasoactive intestinal peptide and oxytocin, which are both known to raise prolactin, right? So, on the right, over here, we now see some ways in which we can actually decrease prolactin, right? What we've all been waiting for. So, First and foremost, make sure none of your medications are the reason why your prolactin is raising. Because if it is your medications, none of this other stuff will help you. These sorts of drugs are really potent, so even you could do everything on this list, but it will of no avail. So again, also minimize stress. We just talked about this. Stress is one of the main culprits for why prolactin is being raised so much. Keep dopamine at a normal level. As we said, dopamine is a inhibitor of prolactin, and prolactin is an inhibitor of dopamine. So, if you keep your dopamine high with natural activities, just as going outside, reading a book, doing some exercise, that could help to keep your dopamine at a normal level. Otherwise, some things that don't help with keeping your dopamine at an adequate level are things like scrolling online, seeing depressing videos, eating junk food. Eating junk food is actually one of the worst ways in which you can mess up. Not only does it mess up your dopamine, just by that dopamine spike that it gives you, and then that sharp, deep depression. And it can also play a toll on your hormones. If you're not getting an adequate nutrition, adequate diet, then your hormones are obviously going to be out of whack. So with that being said, next on the list, avoid phytoestrogens. I'm not saying to avoid soy. Soy is actually pretty good for your health, as we've read in our readings. But phytoestrogens have been shown in excess. People who ingest phytoestrogens, not just phytoestrogens, the bad types of phytoestrogens, like the ones that you find in very processed foods, low quality soy products. Some good examples of nutritious foods that do contain phytoestrogens: edamame, soy, chickpeas, sesame seeds, things like that, but excess phytoestrogens can raise estrogen, which we have seen also raises prolactin. So if you're trying to keep it high, please avoid those phytoestrogens. Next on the list, we have excess caffeine or stimulants. Please avoid those if you're trying to keep your prolactin too high. Coffee has been shown to be good for your health, often, not in excess, but excess coffee can raise your cortisol. Again, cortisol raises prolactin, so we don't want that, and so do stimulants. Stimulants also raise cortisol by a lot, so uh, in that sense, it raises prolactin, and we're trying to keep it low. So next on the list, I'm gonna try to keep it short. Get your sleep in check. Sleep anywhere from, if you're in the older generation, I think about 50 and up, you're gonna need less sleep than someone who's younger. But get anywhere. Usually, we're shooting for 8 hours of sleep, right? And get it in check. Don't sleep at like 12 in the afternoon and wake up at 1 in the morning. That wouldn't be good for you. You have to go with what your body's telling you, or else you're going to be stressed out. So next on the list is get adequate nutrition, right? And moderate exercise. Both of those intertwine beautifully to up your testosterone and lower your prolactin, right? When testosterone's low, even if you have a moderately high prolactin, you will not notice it due to the over overrunning that will happen. Keep your testosterone high, and your prolactin low. So also avoid toxins such as heavy metals and microplastics. Although microplastics don't play that big of a role, everything else on here matters a lot more. But those have been shown to raise prolactin, even if you're doing all these things. It could be something like that. This is minimal to everything else that we've seen, but this is also a way to keep your prolactin low. And last on the list, we have keep a lean body fat composition. The reason why I say this is because it's been shown when you have a high body fat composition, right? That usually raises estrogen, and as we've seen, estrogen raises prolactin, right? So we don't want that. With that being said, we've finished our list, and we can move on to our works cited, right? Here, I have my source for testosterone, my facts about testosterone. Here I have my facts for the effects that testosterone has on men. Here I know it says testosterone replacement therapy, but it was just to see the effects that the body succumbs when testosterone is low. Here I have my facts about estrogen and prolactin. Here I had my facts for well, one of my sources for when prolactin is too high and testosterone is too low. What could be the effects of that? How to reverse it, right? And also here, with that being said, I just want to say that that was the end of my presentation. Thank you so much for being such an amazing teacher, Miss Henry. Absolutely wonderful course. I loved it. It's tangible how much effort you've put into it. It really is, Miss Henry. But with that being said, I just want to thank you. That was my presentation, and good night, good afternoon, and good morning.